Hello, my name is Jazz Gabadon, and I work as a maternal child health care nurse. Postpartum depression affects 10 to 15% of all postpartum women. Postpartum depression can strike any woman, either immediately after she gives birth or many months later. It's not understood why postpartum depression affects some women and not others, but what is understood is that it's no one's fault. It is treatable, and it is important for any woman who thinks she might have postpartum depression to reach out and ask for help. There are three main categories of postpartum disorders: postpartum blues, postpartum depression, and postpartum psychosis. It's important to remember that every mother who suffers from a postpartum disorder is different and may have different combinations of feelings. Dr. Ruta Nonax is a psychiatrist with the Perinatal and Reproductive Psychiatry Clinical Research Program at Massachusetts General Hospital. She is an expert in the treatment of women with postpartum depression. Dr. Nonax explains the first category of postpartum disorders, which is postpartum blues or baby blues.
About 50 to 80% or so of women have the blues, and it typically presents quite early, usually within the first week after delivery. And although we call it the blues, it's not really like depression. It's more consistent with emotional lability or reactivity. So women cry at the drop of a hat. They feel emotionally overwhelmed. They might feel a little bit anxious, but they're not depressed. They don't feel sad about the future. They're looking forward to being with the baby. They're enjoying being with the baby, but things are just a little bit tumultuous at that time.
Postpartum blues are often confused with postpartum depression because they share common symptoms. Postpartum depression, the second category of postpartum disorders, is more serious than postpartum blues.
About 10 to 15% of women have postpartum depression after delivery, and it can occur immediately after delivery, or it can take 2 to 3 months to develop. And postpartum depression really isn't different than depression which women develop at other times during their life. What differentiates postpartum depression from the blues is really the severity of the symptoms. So with postpartum blues, women might be a little bit moody, a little bit tearful, but women with postpartum depression really feel very depressed. They feel like things won't get better, and it really does affect their ability to function.
There are other disorders associated with postpartum depression. Laurie Klein is a licensed independent clinical social worker who specializes in helping women with postpartum mood disorders, as well as other reproductive-related emotional problems.
It's very common for bipolar disorder to emerge at this time of a woman's life. If you have had a history of a manic depressive illness in your family anywhere, this is the time that it may emerge in you. And we have to be very careful to look at this one issue and assume that if a woman is depressed postpartum, that there may be another pole to it.
Some women will have postpartum anxiety, either postpartum generalized anxiety or postpartum panic disorder. And the symptoms of these anxiety disorders don't differ from anxiety disorders which occur at other points during a woman's life. So they'll have a lot of anxiety or a lot of physical symptoms related to anxiety, problems sleeping. What's interesting is that often women with postpartum depression have more anxiety in general. So not only do they have the depressive symptoms, but they can have a lot more anxiety. And often their anxiety focuses on the child. Is there anything wrong? Am I doing everything okay? And they seem to be related to being a mother or to caring for the child.
Another disorder associated with postpartum depression is postpartum obsessive-compulsive disorder, which overlaps with postpartum depression in some ways.
Some women have postpartum obsessive-compulsive disorder, or OCD, and postpartum OCD doesn't differ from OCD, which occurs at other points during a woman's life. So she will have obsessive ruminative thoughts. Often these thoughts are very disturbing and very intrusive. It's hard to get rid of them. And she might also have some compulsions to do things like checking the locks, counting to a certain number, washing hands, worrying about contamination. And what's interesting about postpartum OCD is that many of the symptoms of OCD are related to the child. And women with postpartum OCD will often have these horrible, intrusive thoughts about doing something terrible to the child, like accidentally dropping them out the window or cutting them with a knife, and they'll be very, very distressed by these thoughts. And those types of thoughts also occur with some women with postpartum depression, so there's some overlap between the two disorders.
The third category of postpartum disorders is postpartum psychosis. This is the most severe form of postpartum illness and the rarest.
Postpartum psychosis is really at the far end of the spectrum. And what psychosis is really an inability to perceive reality, and it's a total detachment from reality. So women will have thoughts that are delusions. They will think that the baby's possessed, that there's something horribly wrong with the baby, that the baby has cancer and is dying, and this incorrect interpretation of reality will influence their actions. And postpartum psychosis, fortunately, is very rare. It only occurs in about 1 to 2 per 1,000 women after delivery. And it usually occurs very early after delivery, often within the first 2 weeks.
It is still not known exactly what causes postpartum depression, but most of the recent studies on postpartum depression have shown that it is a combination of hormonal, biochemical, psychosocial, and environmental influences.
Initially, people thought that postpartum depression was somehow distinct from other types of depression, and they attributed postpartum depression to the hormonal changes which take place after delivery. So after a baby's born, you have this dramatic fall in estrogen and progesterone levels, and people thought that that was the cause of postpartum depression. And it turns out that those hormone changes are probably involved, but there are a lot of other things that may trigger postpartum depression, such as problems with a social support network. So if a woman's having marital problems or marital conflict or is separating, those can increase her risk of postpartum depression and may be involved in causing postpartum depression. Also, if a woman's experienced a lot of stressful life events near or at the time of delivery, they also might cause postpartum depression.
It is not known for sure what causes postpartum depression, but what is known is that it is a real illness that needs treatment. Postpartum depression is nothing a woman should be ashamed of.
Postpartum depression doesn't discriminate. All women can develop postpartum depression, whether they're single or married, wealthy or poor, employed or unemployed. You can have a woman who has a perfect marriage, a supportive family, a great sense of self-confidence, good experience with her other children, and after one of those deliveries, she might still have postpartum depression.
Cheryl Dwyer suffered with undiagnosed depression during her pregnancy with her daughter. After giving birth, she was diagnosed with postpartum depression. Now, 6 years later, she shares her experience.
I became depressed about my 10th week when I was pregnant. So when I did give birth, I thought, well, now I'll be happy. Whatever happened during the time I was pregnant would be now over with. And the night my daughter was born at 4 a.m. in the morning, and that night is when I was just walking the halls. I was afraid. I didn't want the baby in my room. I was afraid for the baby's well-being. I thought if she spit up a little, she was going to choke to death. I thought I was going crazy. When the psychiatrist came, he asked us several questions, and I just kept crying and crying and crying. So he sent me home with a prescription, and he gave me the phone number of a therapist to call who specializes in postpartum depression. And that's when the first time I heard the word was postpartum depression.
Melissa and Terry Van Essendelft's son, Beckett, was born 13 months ago. Melissa's symptoms of having postpartum depression began about a week after his birth. Neither Melissa nor Terry had a lot of knowledge about postpartum depression before the birth of their son.
I knew that I would possibly have sadness after I had my son, but I didn't realize to the extent of which I could be sad and even depressed and have it get worse as the time went on. After I had Beckett, I had about a week without any problems, and then I started crying. I cried about everything, and I wasn't crying because I was sad. I just couldn't handle anything.
I think before you gave birth, we didn't really understand the magnitude of the problems that you might have. I mean, all of the baby classes we went to, kind of passed over this postpartum depression. I think we're both aware that it's out there, but I don't think we really knew to the extent to which she would really be depressed. I mean, every morning I would leave for work and she would be crying.
There are many factors that can put a woman at risk for postpartum depression.
Probably the most important risk factor is a prior episode of postpartum depression. So if a woman has had one episode of postpartum depression, she has about a 50% chance of having another episode after a subsequent pregnancy. Also, if she's had a history of depression prior to pregnancy, her risk of having postpartum depression is also elevated.
I knew that some of the risk factors for postpartum depression were a previous diagnosis of depression, which I've had. I lost my father at a fairly young age, and that caused a lot of emotional problems.
One of the populations I see coming in with postpartum depression a lot are those women who have had some problems related to delivery or problems with early child care, so problems with breastfeeding, or the baby is ill, has a lot of medical problems. And it seems that the stress related to these events can actually precipitate postpartum depression.
When I meet a woman who's pregnant, and we're concerned, or the doctor's concerned, that she might have a postpartum depression, we look at other factors, like, has she ever been depressed before? Has she ever had PMS? Has she ever had someone in her family commit suicide or have a psychiatric disorder? And those are predictors, but not necessarily, it doesn't necessarily come to fruition. So the best thing to do is expect the worst. The best thing to do is say, you might get this because you have a lot of the factors that we see, but you might not. So let's be prepared for it anyway, just in case.
Postpartum depression can strike any postpartum woman, but there are warning signs that show that a woman may be suffering from postpartum depression.
Some of the signs and symptoms were the severe anxiety, the fears of being a mother, the fears of taking care of your baby. So I had these phobias that really came out of nowhere. Crying because the sky wasn't blue enough that day or something. The feeling of hopelessness. Like I said, I used to just stare out a window and wish I was somebody else.
I was sad. I was very sad, and I cried. I couldn't handle things going wrong. I couldn't handle not being able to find things when I needed them. I looked at him and thought plenty of times that we didn't do the right thing.
Other warning signs that may signal that a woman is suffering from postpartum depression are these. She can't concentrate. She doesn't enjoy things that she used to enjoy. She has lost interest in sexual intimacy. She has no energy and is tired all the time. And she either has no appetite or eats too much. If a woman feels that she is suffering from postpartum depression, getting help should be a priority. Postpartum depression is a real illness that does need to be treated.
If a woman thinks she has postpartum depression, probably the best resource for her is her obstetrician. That would be a good first start, or her primary care provider, whoever she feels most comfortable with. What I've seen with some women is that they approach their physicians and their physicians reassure them and say, don't worry, it's nothing, it'll go away. But if the symptoms don't go away, it's been a couple of weeks that you've had the symptoms, the woman should reapproach her physician.
Although they are rare, there can be emergency situations that warrant immediate intervention for a woman suffering from postpartum depression.
If there's an emergency situation and a woman looks like she's out of touch with reality, she's fearful about hurting her baby. She's so depressed she can barely get out of bed. She's having a panic attack. Take her to the emergency room. Take her to the hospital and get her assessed. Most emergency rooms have psychiatric people on hand to help make an assessment.
Diagnosing postpartum depression is difficult because there is no standardized scientific test to tell how it's going to be for a woman to adjust after she gives birth.
There's no blood test that you can take. You can't pick it up on a CT scan or an MRI. So diagnosing the disorder involves going to somebody, an obstetrician, a psychiatrist, or psychologist who has familiarity with the disorder. And if a woman has a certain number of symptoms, she probably has postpartum depression.
There were several things involved in being diagnosed for my postpartum depression. The first began with a visit from a psychiatrist while I was still hospitalized. And then from there, he wanted to set up a different visit with me. We met for almost 2 hours in the hospital. And then he wanted me to see a therapist who specialized in postpartum depression. And still at that point, was I tagged somebody with postpartum depression? Probably not, but there were enough warning signs up for this particular psychiatrist to know that I needed something additional than an anti-anxiety pill, and also that I needed some therapy.
It is very common for a woman diagnosed with postpartum depression to feel a great deal of shame and embarrassment about having postpartum depression.
This is supposed to be a joyous time of your life, and I think this is what separates postpartum depression from other depressions. Is somebody can go through a depression over the death of a loved one or a divorce or something, a job loss, or just a depression, something they're predisposed to. But when you suffer depression because you have given birth, that's really, to me, I felt really strange and not connected with society, because why wasn't I happy that I was giving birth and I was bringing somebody into this world, and all the good things that come with babies, flowers, balloons, stuffed animals? Why wasn't I happy about that?
I was definitely guilty that I couldn't handle it, and that I was focusing so much on me when he was so little. To me, I mean, he was 4 months. He was still really small, and he needed a lot of things. And I felt a lot of guilt that I had to worry about myself, and that I felt like I wasn't there for him like I should have been.
When I meet women and they feel ashamed of themselves and they feel like it's their fault that they're so depressed, I just tell them simply it's not. And I try to educate them about what's happening in their bodies, and that this is an endocrine crisis, and that all their hormones and all their organs are all connected, and they end up in the brain. And the brain is where this stuff happens.
There are many studies to suggest that individual therapy or support groups can be very helpful for treating postpartum depression. Finding a therapist is sometimes easier than others. You would want to contact your obstetrician, see if they have resources that are available to them for treating women during pregnancy and the postpartum period. Another resource is Depression After Delivery and Postpartum Support International. They have lists of treaters, both psychiatrists, psychologists, social workers who are familiar with treating postpartum depression. And the next step would be to meet with one of these doctors and make sure that it's a good match, and to make sure that you feel comfortable talking to this person, because the treatment is based on your comfort with talking about the issues that are troubling you.
What I really needed and wanted was contact with other moms that had problems, which I couldn't really find until I found a group, Moms and Babies groups, through the Children's Center, which was fabulous. I went 2 times a week for months just to hang out with other moms. And that was treatment in itself, in a way, because there were a lot of other people having to deal with the same things I was dealing with.
Taking time to heal from postpartum depression is important and necessary. There are some self-help steps a woman can take to feel better. These steps give a woman with postpartum depression more power over her healing than she may think is possible.
The first line of defense is taking care of yourself. And in order to take care of yourself, you have to ask for help. You have to have people who say, can I do anything for you? Have them do a load of laundry. Have them take the baby. Have them take the baby so you can go for a walk. There are a handful of things that I tell women. One is rally your support systems. Get those people in there who can help you. 2, get exercise. Exercise is a great remedy for panic, for depression, and just for your overall health. Eat well. Have something to look forward to every day. Create a routine so that if you go to the library on Mondays and you go to a play group on Tuesdays and mother support group on Wednesdays, have tea with a friend on Thursday, but really make sure you have something every day to look forward to. Really, really helps. When you're considering whether to take medicine or not, you need to consider whether you're going to be able to take care of your baby. And if not taking medicine is going to make you feel less shame, that's one thing. But if not taking medicine is going to make you not capable of responding to your spouse or partner or responding to your baby, then maybe you need to think it through again.
I just felt I was weak, that I needed some type of pill to help me feel happy, if you will, to help with this anxiety. And of course it takes the antidepressants. I was put on antidepressants and an anti-anxiety pill, and it takes a good 6 weeks. Well, it did for me, for it to at least have some type of effect.
One of the issues about using medications in this population is that about 50% of women are breastfeeding, and there are definite concerns about exposing the children to the medication in the breast milk. And what we know is that most of these medications, or actually all of these medications, are secreted into breast milk, although the concentrations of the medication appear to be relatively low. And certainly what we've seen in the few studies that have been conducted is that the risk of problems in the nursing child is very, very low. So we really feel that at this point, many of the benefits of taking medication outweigh the risks to the nursing infant.
The medication that they would normally prescribe would have been what he wanted to give me was Ativan for anxiety and Prozac for depression. But I couldn't be on the Prozac if I was breastfeeding, and that was a big decision for us. It was really, really important to us. A lot of other things hadn't gone the way we wanted, and I'd worked really hard to be able to breastfeed Beckett. So I didn't take the medication for a while, and then everything was working fairly well. Things were helping, but I needed it. I needed to go on something, and I needed to realize, I think when I finally realized that as good as breast milk was for him, to have a mom that cried all day and wouldn't go anywhere and couldn't get out of the house wasn't going to help him either.
A woman who is diagnosed with postpartum depression may be worried most about if and how her illness will affect her baby.
I had a lot of anxiety and worry that he was going to always have this weird feeling in the back of his mind or something, that I didn't want him.
And I was really concerned that he was going to not be attached. He wasn't going to be properly socialized. He would start pushing people away. He wouldn't be interested in social interactions, things like that. And that really concerned me.
There are many studies which suggest that untreated postpartum depression can be harmful to the child. Some of the earliest studies suggest that even relatively mild forms of depression can have a negative impact. So if you look at the kids who are raised by depressed mothers, they have delays in their cognitive development as well as delays in their motor development. So they speak later, they walk later. And these effects can persist into school age. So if you look at kids who are 5 and 10 years of age, they also show some delays in development. Children of depressed mothers are also more likely to have behavioral problems, and those manifest early as feeding problems or sleep problems. And when they become school-age kids, these children are more likely to have behavioral problems like temper tantrums or aggression towards both parents and their peers.
When I look back, I don't really remember the first year of her life. So to compensate for not remembering that first year and spending time on me and not giving 110% to my infant daughter, I then, in later years, when she was 2, 3, 4, catered to her every need, because how can I make up this first year that I don't remember? I'm sure she wasn't harmed by it at all. She had a loving father, a loving older sister and brother, and loving family.
Although it's clear that postpartum depression can have a negative impact on the child, it's important to recognize that there are protective factors. So that having other caregivers, an involved father, a stable environment, all can be protective. And it's also important to remember that although the mother-child unit is very sensitive, it's also very flexible. And children, especially when they're young, are incredibly flexible.
If a wife, daughter, or friend has been diagnosed with postpartum depression, it is important for her husband, family members, and friends to be a part of her recovery.
Just having another person in the room in certain situations can make it much better. Just having company. Even if the person who's supporting you isn't doing anything, just being there with you is really helpful. Because this affects the whole family. The grandmother's watching her daughter, waiting for this joyous thing to happen, and she's not getting to share that because she's having to take care of her daughter. The husband has to go back to work, and he's leaving this crying woman behind and doesn't know what he's going to come home to. A lot of husbands will say that. I don't know what I'm going to find when I come home. So they need to help their wife ask for help and get some of their friends or whoever, maybe their relatives, to come in and be there and be available.
My mother came back and stayed for 10 days.